Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Carbon monoxide poisoning. Introduction. Carbon monoxide, or CO, is a gas that has no odor or color. It is very dangerous and can cause sudden illness and death. It is often hard to tell if someone has CO poisoning because the symptoms may be like those of other illnesses. People who are sleeping or intoxicated can die from CO poisoning before they have symptoms. This program explains carbon monoxide poisoning. It discusses its causes, signs, and treatment. The program also includes tips for preventing carbon monoxide poisoning. Carbon monoxide poisoning. Carbon monoxide poisoning happens when you breathe in carbon monoxide fumes. It can cause sudden illness and death. CO is found in combustion fumes like those produced by cars and trucks, small gasoline engines, stoves, and lanterns. CO is also made when burning charcoal and wood or using gas ranges in heating systems. CO from combustion fumes can build up in places that do not have a good flow of fresh air, poisoning humans that breathe in the fumes. CO can also poison animals if they are kept in a poorly ventilated area. Red blood cells pick up CO quicker than they pick up oxygen. If there is a lot of CO in the air, the body may replace oxygen in blood with CO. This blocks oxygen from getting into the body, which can damage tissues and result in death. Who is at risk? All people and animals are at risk for CO poisoning. Certain groups are more sensitive to the effects of CO poisoning, such as unborn babies, infants, senior citizens, people with chronic heart disease, anemia, or respiratory problems. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Symptoms. The most common symptoms of CO poisoning are confusion, chest pain, dizziness, headache, nausea, vomiting, weakness. When people breathe in too much CO, it can also cause loss of consciousness and death. People who are sleeping or intoxicated can die from CO poisoning before ever experiencing symptoms. It is often hard to tell if someone has CO poisoning. Unless suspected, CO poisoning can be difficult to diagnose because the symptoms are similar to other illnesses. If someone develops the symptoms of CO poisoning, immediately move them to an area with fresh air. Call 911 as soon as the person is moved into an area with fresh air. Diagnosis. Most cases of carbon monoxide poisoning are not suspected until an emergency happens. To confirm your diagnosis, a healthcare provider may take a blood sample to test for carbon monoxide in your blood. A small blood sample is taken from a finger prick or from a vein. CO concentration in the blood is measured in parts per million, or ppm. Most people will not experience any symptoms from prolonged exposure to CO levels of approximately 1 to 70 ppm. Some heart patients might experience an increase in chest pain. As CO levels increase and remain above 70 ppm, symptoms become more noticeable. At sustained CO concentrations above 150 to 200 ppm, disorientation, unconsciousness, and death are possible. Treatment and supportive care. CO poisoning is often treated with oxygen. This can be done in two ways. Breathing pure oxygen, spending time in a pressurized oxygen chamber. Pure oxygen is given through a mask placed over your nose and mouth. This gets oxygen to your organs and tissues. A ventilator or breathing machine may be used if you are unable to breathe on your own. Sometimes hyperbaric oxygen therapy is needed to treat CO poisoning. This treatment uses a pressurized chamber in which the air pressure is more than twice as high as normal atmospheric pressure. Hyperbaric oxygen therapy speeds the replacement of carbon monoxide with oxygen in your blood. It may be used in cases of severe carbon monoxide poisoning. Pregnant women may be required to use this treatment because unborn babies are more likely to develop problems from carbon monoxide poisoning. Prevention. Carbon monoxide poisoning may be prevented by taking some simple precautions. This section explains some ways to prevent CO poisoning. You can buy carbon monoxide detectors for your home. These detectors work best in areas where you sleep. It is important to check the batteries regularly. To be safe, check the batteries at least twice a year. Carbon monoxide detectors are also available for motorhomes and boats. If the CO detector alarm goes off, exit the house and call the fire department or local utility company from a nearby phone. Finding and repairing sources of carbon monoxide is very important. Never return to your home after a CO detector alarm has gone off until the source of CO has been found and fixed. Your local fire department or utility company may be able to help. You can also prevent CO poisoning by ventilating your garage. You should always open your garage door before you start your car. It is very dangerous to run your car in a closed garage, especially if you have an attached garage. Be sure to keep the garage door open and the door to your home closed whenever a car is running. It is even safer to warm up the car after moving it to the outside of the garage. Follow the instructions for using your gas appliances closely. Do not use a gas stove or an oven to heat your home. Portable gas camp stoves should only be used outdoors. Fuel-burning space heaters should only be used when someone is awake to monitor them. Doors and windows should be kept open to provide fresh air. Never run a generator in a basement, garage, or other enclosed space. All gas appliances and fireplaces should be kept in good repair. Gas appliances should also be properly vented. If you have a fireplace chimney and flue, clean it every year. You can ask your utility company to check your gas appliances, including your furnace, once a year to make sure they are safe.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Carbon monoxide, or CO, is a gas that has no odor or color. It can build up in places without a good flow of fresh air. CO is produced by cars and trucks, small gasoline engines, stoves, and lanterns, or by burning charcoal and wood or using gas ranges and heating systems. Everyone, including animals, is at risk for CO poisoning. It is often hard to tell if someone has CO poisoning because the symptoms may be like those of other illnesses. People who are sleeping or intoxicated can die from CO poisoning before they have symptoms. Most cases of carbon monoxide poisoning are not suspected until an emergency happens. To confirm your diagnosis, a healthcare provider may have a blood sample taken to test for elevated levels of carbon monoxide in your blood. CO poisoning is treated with oxygen. Pure oxygen may be given through a mask placed over your nose and mouth. It can also be given in a hyperbaric chamber, which speeds the replacement of carbon monoxide with oxygen in your blood. You can prevent CO poisoning by installing a CO detector in your home, near places where people sleep. It is also important to keep CO fumes from building up in your home. You can do this by properly ventilating your garage and other areas where CO can build up.
Thank you for using Explain.